Today is the APHA's Rally for the Public's Health, where attendees will head down to the National Mall to advocate for key public health issues. But before we head over, we caught up with the team from Fired But Fighting.
Fired But Fighting is a grassroots coalition of former CDC folks and public health professionals across the country. It started as a newsletter after myself and a bunch of my colleagues were fired from the CDC.
The rally today is prioritizing fighting for our nation's public health, for a system that works well for everybody, and also to eliminate a lot of the interference we're seeing in public health. Over the past, 10 months now, there have been cuts to staff, cuts to funding, and a lot of different things interfering in our ability to do our jobs as public health professionals.
Myself and my colleagues will be attending the rally today because we really care about both on-the-ground advocacy, showing up in numbers, talking to people about the importance of public health, in addition to using our voices in other ways, talking to the media. Also, we've been trying to one-on-one speak with congressional members to help them understand, what cuts to CDC mean for their communities and their constituents. And I think that's the real need here from public health professionals generally. People don't know what public health is. There's so much nuance in the field. Public health professionals have this opportunity right now to talk about that work that they did, show the passion that they have. It humanizes us, but it also helps, break down some of the elitism and the silos that we see in the field, and makes us kind of more approachable to the public, which it should be. It's for the public. Public health is for them, and they should understand what it is.
Attendees of the rally can expect to see myself, a couple of people from state and national legislatures, as well as other public health professionals representing, NIH and academic institutions and community-based organizations.
We're going to fight, and we are going to win on behalf of all of those people.
I am a furloughed federal worker. I work for the NIH, and I am here to support public health. I wanted to bring some levity to the situation. Halloween just ended, so pickles were easy to find, and I really wanted to have a sign that matched.
I wanted to come and be part of the rally today to support public health, as we are in a crisis right now in our nation, and the more people who stand together, the easier it's going to be to topple this regime.
The crisis that they created by gutting resources for our nursing homes. 1 in 4 nursing homes at risk of closing. I already had one in my district close 2 weeks ago.
Right now we have a healthcare crisis in this country, we have a public health crisis in this country, and it's really gonna hit my state one of the hardest in the whole nation. And so I'm here to make sure people know that I'm with them, that we're fighting against this, we're fighting to make it better. But it's important that politicians hear directly from the people, directly from the professionals, and directly by organizers who are directly impacted.
Our biggest issue facing public health right now is an unqualified leader in the Department of Health and Human Services who is making every decision that goes against everything that public health stands for.
At the end of the day, debates that go on in DC on statistics and things that we've heard is one thing. But when you hear directly from the people that are from all around the country, right? This isn't just people from the DMV area, all around the entire country, that's power. And I'll tell you, at the end of a day in DC when I've had 20 or 30 meetings and I'm sitting at home with my Taco Bell watching Netflix, I remember the meetings I had with people who gave me personal stories from things that have happened to them in their life. Here we have hundreds of personal stories across the country talking about why we need to save our public health system.
Trump has cut NIH funding for Alzheimer's, for Parkinson's, for diabetes.
I think that we need to go back to our roots, go back to science, go back to understanding the data, and move forward as a country.